Yeah, and today we're going to talk about high blood pressure. So the first question is, what is high blood pressure and why do I care? Well, the first thing is, what is high blood pressure? Well, I'm measuring when I check your blood pressure is the reserve pressure that you have in order to do things. See, a normal person has about 6 liters of blood and about 12 liters of blood vessels, which means you move your blood around to do different things. If you go for a walk, you're going to send more blood down to your legs. After you eat, you send more to your stomach, those kinds of things. And you need to have blood pressure there so that you can switch things around. That way, in case you decide to stand up, you have more blood to send up to your head so you don't pass out. As we get older, very often our bodies get more concerned about passing out and those sorts of things. And so they slowly ratchet up this reserve blood pressure in order to be ready in case things happen. The problem is that if the pressure gets too high, it damages the lining of blood vessels, increasing your risk of heart attacks, strokes, kidney failure, and these sorts of things. And this is why we treat it. So whenever you treat things, there's two things that are important. One is that we know that the problem causes a problem, and two, that we know that the solution makes the problem better. So when we look at high blood pressure, when your blood pressure goes from 120 to 130, that doubles your risk of a heart attack or stroke. At 140, it's 4 times the risk. At 150, it's 6 times. At 160, it's 8 times, and so forth. So clearly, having high blood pressure increases your risk of heart attack and stroke. Conversely, many medications which are used to lower blood pressure reduce that risk, and many of them can reduce them more than simply by lowering the numbers. So, my favorite medication for treating high blood pressure is a medicine called lisinopril. Lisinopril is a medication which is the most studied blood pressure medication in history, 140 randomized controlled trials. It will reduce that increased risk of heart attack, bringing the numbers back down, and then it takes an additional 32% risk off of cardiovascular mortality, allowing you to be treated to actually a below normal risk, which is really important because 1 person in 2 dies of heart disease or strokes. And so we don't like the top half of risk. I like to be on the bottom half of risk, and that allows me to do that. Not all medications, however, are good for blood pressure. There are actually blood pressure medicines that will lower your blood pressure and actually increase your risk of a heart attack or stroke. And so those sorts of medications I certainly try to avoid. Some blood pressure medicines have been studied and shown to lower blood pressure but have no effect on your heart attack or stroke. And certainly medications like that, hydrochlorothiazide being an example of that has multiple studies that show no benefit in cardiovascular mortality, are best left alone. And some blood pressure medicines lower blood pressure, but we don't know how they affect your mortality, and certainly I like to stay away from those as well. When it comes to treating high blood pressure is one of the most cost-effective things that I get to do as a physician. When we look at treating high blood pressure with a medicine like lisinopril, studies show that for about $140 spent on this medication, it will make you live a year longer. So there's not a lot of things I can do for $140 that will make you live longer. So that makes it a really good investment. Now, not everybody can be controlled with one medication. When it comes to treating high blood pressure, some people need one. That's about 30% of people. About 30% of people require 2 medications to get to control. 30% require 3, and 10% require 4 or more. If we need more medications, well, it's better to use them and we get things controlled. Obviously, my goal is always to have people on the lowest dose of the fewest medicines possible, but heart attacks and strokes are certainly to be avoided. The other thing about high blood pressure is early treatment is effective at reducing your overall need for blood pressure medicines. So if I take someone and they develop high blood pressure, and I immediately start them on lisinopril and I get their blood pressure controlled, on average 10 years later they will be on the same dose of the same medication with excellent control if they take it regularly. On the other hand, if I delay 2 or 3 years before starting a blood pressure medicine, at the end of 10 years, on average, they'll be on 2.5 medications in order to have less good control. So taking lower dose early intervention on high blood pressure medicines means that in your lifetime, you'll be exposed to less medications, requiring less medications, and you'll be overall healthier. In addition to that, there are things that you can do to try and get rid of blood pressure or help to avoid developing high blood pressure in the first place. But when we look at medications like lisinopril, if you're going to make an intervention to try and get rid of your high blood pressure, taking lisinopril when you're trying to make these other changes actually makes you more likely not to need the medication after the intervention. So what things can I do to get rid of high blood pressure? Well, there's 4 generally recognized modifiable risk factors. And those are weight, exercise, salt, and alcohol. Not everyone is going to respond to any given one, and not everybody starts in the same position in terms of risk. Certainly, if you're already at your ideal body weight, I do not recommend becoming dangerously thin in order to treat your high blood pressure. On the other hand, I've had people who are quite heavy who've lost significantly amounts of weight, and it doesn't always affect their blood pressure. Most of the time it does, but certainly it's not all of the time. Exercise as well. Some people exercise regularly, and so adding to that is not generally helpful. For people who are sedentary, who move to doing more exercise, it certainly can be helpful, but there are plenty of people who I've treated who have significantly improved exercise, and that does not get rid of their high blood pressure. Now, that doesn't mean they're not healthier, and I certainly recommend good diet and exercise as well, but I always want to be honest with people about what capacities I have and how much I expect an intervention to make a difference. Salt is something that will work for virtually everyone if you lower it enough. So there is a diet called the DASH diet. It is absolutely horrible. Basically, you can't have anything with flavor and basically no meat for the rest of your life, and it will lower your blood pressure. Very few people are interested in actually pursuing that once they see that it's basically, unseasoned vegetables and fruit for the rest of your life, but there are people who embrace that, and it can be effective. Between the DASH diet and a normal American diet, there's a lot of room. And I've certainly had people who stopped adding salt to their food and were able to put off needing high blood pressure medication for periods of time. And so that's certainly something worthy of consideration. Finally, alcohol. Many people are quite sensitive to alcohol. So I've had people who had 1 or 2 drinks per week. And by cutting that out, they didn't need a blood pressure medicine, and in their mind, that was better than having your 1 or 2 drinks. I've had other people who cut down from very heavy alcohol use to none. It did not affect their blood pressure, however, it did make them a lot healthier otherwise. So those are things that can be done. All of those things, though, if you take the lisinopril while you are losing weight, exercising, changing your diet, cutting out alcohol, you are less likely to need the blood pressure medicine 6 months later if you take the medicine while your blood pressure is coming down. So that's one of the reasons why I talk about treatment before I talk about trying to get rid of the condition. This is one of the most important things I get to do as a doctor in terms of making you live longer. So if you have a history of high blood pressure, you have questions about that, please feel free to come in and see me, and I hope you have a nice day. Thanks.